Hello, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Today I'm going to go over dynamic motions, and I'm going to demonstrate for the cervical spine, but these techniques and principles can be used for any joint in the body. The most important thing when performing dynamic motions is to always work through a symptom-free range of motion. Dynamic motions can be used as preventative, they can be used for acute conditions, and they could also be used for chronic conditions. Again, you always want to work through a symptom-free range of motion. When we speak about symptoms, those symptoms can be in the joint that is being moved, or it can be in a different area. For example, the cervical spine is the medical name for the neck. If you are bending your head forward into cervical flexion and you start to feel symptoms in the lumbar spine, which is the medical name for the low back, you want to stop immediately. You want to work through a range of motion where there is no symptom present. And like I said, that symptom could be in the neck, could be in the mid back, could be in the low back. If you start to feel a symptom, then stop immediately. For example, I'm bending my head forward and I start to feel pain right about here. So I go back to the starting position, and in the next repetition, I stop short of that position. So that's what I mean by working through a symptom-free range of motion. And you want to do that in all ranges of motion. You also want to perform dynamic motions very slow and control the motion in both directions. For example, if you are turning your head to the left, work very slowly, and then when you are coming back to the neutral position, again, work very slowly. You're not whipping your head over, and you're not turning your head quickly back. You want to move slowly. When we are performing dynamic motions for the cervical spine, there are different ranges that you can do. The first motion is called flexion. And this motion is bringing the chin towards the chest. Again, you want to work slowly through a symptom-free range of motion. And then extension is bending the head backwards as far as you can. The next motion is left rotation. Now you always want to be careful. Like I said, you want to stop before there are any symptoms. And those symptoms can be pain, numbness, tingling, burning, dizziness, any type of symptom that is associated with the motion. You want to stop short of that symptom. For example, if you are bending the head to the left and you start to feel pain in the neck, or you start to hear ringing in the ears or headache pain or dizziness, go back to the starting position and then work through a symptom-free range of motion. This motion is called lateral flexion or lateral bending. In this motion, you are moving your left ear towards your left shoulder. Do not shrug the shoulder, just move the neck. Again, the cervical spine is the medical name for the neck. And then you could perform the same motion going to the right. So you are working through all planes. Again, you can do cervical flexion, where the chin goes towards the chest. All motion should be in a slow and controlled fashion. Cervical extension, which is bending the head backwards. Left cervical rotation. You want to make sure you are not experiencing any symptoms into the arm or the hand. Right cervical rotation. Left cervical lateral flexion, also known as lateral bending. And then right cervical lateral flexion. And you're not holding the positions, you're not bouncing at end range, you are just moving slowly. This is a dynamic motion. Also, you can do retraction, which is moving the head straight backwards, And you can do protraction, which is moving the head forward. Again, the number one rule is to always work through a symptom-free range of motion when performing dynamic motions. When you are performing dynamic motions, move in a slow and controlled manner. Thank you everybody for watching today's video on spine health. Always remember, never perform an exercise that elicits or intensifies symptoms. Always work through a symptom-free range of motion. Always check with a medical professional before starting any type of exercise program. Please feel free to like, comment, and subscribe. You can visit my website, championshipchiropractic.com, where you get information on my book titled Running, Maximize Performance, and Minimize Injuries. And you could also find my blog on my website. My blog contains articles on spine health, sports medicine, chiropractic, health, fitness, and nutrition. Thank you again for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.